In this video, I'm going to show you exactly that doesn't matter what the simulation is in your dental exam, especially in the communication part. You can always address the activity in a very effective way. But that's possible only if you can structure your response in a way that it is organized and you can focus on just the key aspects that you want to address. There could be situations where a simulated patient is available. Now that could be the evaluator himself or herself, or that could be a third person, and you have to respond according to the question that has been presented to you. Or there could be activity that requires you to ask questions to that simulated patient. Doesn't matter what the situation is, there are some key components of that situation. There could be a problem, or we can also call it as a conflict. Then you are the person responsible to find solution to that problem. So there could be some information available in the stem of the question and some additional parameters or metrics or a radiograph that could be present. And you have to take a look at the radiograph and match it with the information that is given in the stem of the question and form your responses, form your questions appropriately. The first thing to start with when you are actually interacting with that simulated patient is to go ahead and say your introduction. And that would involve stating your name and what's your relationship with the practice and what can you do for the patient at that very moment. Secondly, identify the problem. Looking at the radiograph or the information that is available in the question, find out what exactly the problem is. And once you have identified the problem, now it's your responsibility to discuss the solution. What options does the patient have in order to get cure for that problem or a solution for that problem? And what are the options available? And which option do you recommend for that problem and why? Then once you are done with this part, do conclude that whatever you have discussed with the patient, it would require you to discuss the symptoms, findings and causes of that problem in that conclusion part. So basically it's a summary of whatever you have discussed and ask them if they are ready to go ahead. Finally, check patient's understanding. You can do that by asking, do you follow along, or do you have any questions regarding anything that I have discussed with you? So if they say yes, they would ask a follow-up question, or if they are okay with whatever information you have shared with them, they might not have any question. So this is one way to address any simulation activity that could present in your communication skills task or OSCE task or situational judgment. I am Rahul Monga and thanks for watching this video.